Hello, we're back. And in this set of video lectures, we're going to be covering coating diseases and disorders of the skin. Okay, as mentioned, we're covering coating diseases and disorders of the skin, which fall into code categories L00 to L99. Think of this chapter somewhat like an anatomical map. We'll start with infections, move to inflammatory issues like dermatitis, and end with chronic conditions. One thing to remember in our world, dermatitis and eczema are essentially the same thing. So again, we covered how these diseases are laid out, and you can see just what we're talking about here. We have the infections, L00 through L08, L10 covering bullous disorders, dermatitis, and eczema, L20 through L30, papulosquamous disorders, L40 through 45, and so on. And then, as you'd expect, as we've seen in other chapters, L76, intraoperative and post-procedural complications, and L80, other disorders of the skin and subcutaneous tissue. Again, this is another chapter that has a fair number of excludes notes. For example, you'll see exclude 2 note that identifies conditions in other chapters that may be coded with diseases of the skin, subcutaneous tissues. Their directions to code infectious agents as a cause of the disease from B95 through B97. And again, dermatitis and eczema, for our purposes, they mean essentially the same thing. And again, sometimes skin conditions are caused by drugs, other chemicals, what have you. This includes L23, the allergic contact dermatitis, L24, the irritant contact dermatitis, L25.1, L27.0, L27.1, contact dermatitis due to drugs and medications, and so on. Some skin conditions can be caused by other diseases and coded in diseases classified elsewhere. When we're coding these types of conditions, we have to look at some things. Is it from a rash from a drug they took or something they touched? Always look for these use additional codes in the tabular. We often need to name a specific bacteria such as staph, strep, what have you. And there's chapter specific guidelines for this chapter and covering pressure ulcers, stages 1 through 4. And again, we assign as many of these codes as needed to identify all possible pressure ulcers the patient has, if applicable. So bottom line, if a patient has 5 ulcers, you have codes for all 5. If the ulcer is covered in what they call the slow eschar, eschar, the slow, the black, what tissue, what have you. Whoops. It can't be staged. So, again, we have these unstageable pressure ulcers. And sometimes they will be with other pressure ulcers that you can stage. So important to bear that in mind. And how do we know the stage? It's guided by the clinical documentation of the stage or the documentation of the terms found in the alphabetic index. If there is no documentation of the stage, the provider should be queried so we can assign the correct code. And again, you want to make sure you review these specific chapter guidelines. They're in the front of your textbook. Some of the more important points are called out. They're also in your code books, and they're also in the PDF that's posted on Canvas. One thing that gets asked frequently, and sometimes this is on national exam, is what do you do with pressure ulcers that are documented as healed? Again, the general coding guidelines guide us on this. If a ulcer is completely healed at the time of admission, we don't code for it. The fact that they had a year ago, we're coding what exists at the time that the patient's seen or admitted. However, if a pressure ulcer is documented as healing, that's not the same as healed. Code the pressure ulcer in the stage as present if it's described as healing. If the documentation doesn't provide the stage, you would query the provider or code, I'm sorry, you would code as unspecified. If the documentation is unclear as to whether the patient has a current or new pressure ulcer or has a healing pressure ulcer, that's when you would query or ask the physician. Okay, for ulcers that are present on admission but healed at the time of the admission, in other words, they healed while the patient was in the hospital, we'd assign the code for the site and the stage of the ulcer at the time of admission. And again, sometimes pressure ulcers are healing and they're getting better. Sometimes they get worse. And in this case, we may have a pressure ulcer that's getting, changing or evolving into another stage. In this case, we'd have two separate codes, one for the site and stage present on admission, and the other one for the ulcer site and the highest stage that's reported during admission. I hope that makes sense. And that's all I have for you. Come back and we'll finish our lecture on coding diseases and disorders of the skin. Thank you for watching. Bye now.